Well, moving on now, we have a COVID-19 survivor who happens to be the Honorable Commissioner for Information in Delta State, Mr. Charles Anyagu. He'll be sharing with us his story on how he contracted it and what he did to treat himself. Welcome with us, the Honorable Commissioner for Information at Delta State.
Thank you very much, my sister, and I must appreciate the good work you are doing in TVC.
Thank you, sir. So you contracted the virus. Were you able to trace how that happened?
Well, at the level we are now, nobody can easily say this is where he contracted the virus because to a very large extent it has gone into community transmission.
Yes.
It's unlike at the beginning in February, March, somebody will ask you, which part of the world did you travel to? From which part of the world they started asking you, did you travel to Lagos or Abuja? That at the initial time was seen as the epicenter, though at the moment Lagos still maintained that particular unenviable position. And so over time, the virus moved to almost every other part of the country. And so if you are in a place like Delta, nobody will ask you whether you travel to Abuja or Lagos because it's already here with us.
Right.
And the moment you can no longer trace who you had contact with, so that you can say, okay, because you met with this person, then of course, it means you are not able to identify who must have been the source of you contracting the virus. So at that moment, it becomes the medical people refer it as community transmission.
Right.
So that for me was what will happen.
Honorable, you are my colleague now in surviving the COVID, the virus.
So you mean you tested the thing too?
So I wanted you to talk, because a lot of people came on my page and said I got paid by government to promote the virus they don't believe exists. I wanted you to share what it was like dealing with it.
Somebody even asked me that very funny question, a friend of mine. And when he saw it maybe in some of the news media about the fact that I and the SSG contracted the virus, and he called me and said, please, how much did they pay you? And I asked him, I said, you've known me for quite a while. How much do you think you will pay me?
I even asked how
just
much
by himself. He now said, no, that's true, that's true. Because if you are going to pay somebody, there are those you pay, if you give them maybe 1 million, they will be dancing. And where will you even get the 1 million from? So it's actually quite laughable for individuals to think that they need to pay somebody for you to say that you have a COVID-19.
So I wanted you to share what the symptoms were like for you. What did you go through? How was it like?
Well, for me, mine was somehow on the mild side, but even at that, I can tell you authoritatively that it's different from the malaria people are talking about. Good enough for a very long time. We all at one time or the other suffer malaria, and we know the difference. You know that malaria, because we are used to self-medication in this part of the world, you can just go across the counter and tell them to give you any of the malaria drugs. And then by the time you take it 2 or 3 days, you are back to duty. But that is not the same thing with COVID-19, because even when you continue to treat malaria, because some persons, it comes in form of fever, and so you suspect that it's malaria. But you discover that you will treat it, it doesn't go. In my own case, I had thought that I was just going to do, because there was a lot of fear amongst people to present themselves for tests, particularly even those who are sick. And I said, okay, since I was not feeling anything, let me go and take the test, hoping that it will even be negative so that I can tell people there's no big deal, go and test it, I've done mine. But having gone for the test, and in less than 24 hours, I discovered that I have lost my sense of smell. I say, hey, there's something wrong then. And another 24 hours when the result came out, it turned out to be positive. And I made myself available to the medical doctors and some other health personnel who advised me. They were able to examine if I was capable of self-isolating in my home and being treated at home, and it was obvious that that can happen since I wasn't staying with my family here in Asaba. And so along the line, a lot of medication were prescribed, and I ensured that I maintained the routine as advised by the medical practitioners. And by the grace of God, along the line, I went back after about 16 days for another test, and it turned out negative, and I give God the glory.
I want to ask you, what would you say, because it doesn't exist. I've been facing it a lot. I know it exists. What would you tell the people? What would you advise people who keep saying it doesn't exist, it's government trying to chop money? What advice would you give them?
Well, there are, first of all, let's look at the reasons why individuals may feel it doesn't exist. Of course, you know that in this part of the world, there has been a lot of mistrust or lack of trust between the government and the governed, and you all do understand why that is the case. Because over time, governments have promised what they are going to do for the people, and then at the end of the day, the people hardly see those things coming to fruition. So whenever government says it's going to do it, they just say it's political talk. And because of that, and you see government being the one leading the campaign, so individuals still believe that it's still the normal thing. But it's different from being the normal thing. They need to believe that COVID-19 is real and that government is doing all it can in the circumstance to see that they flatten the curve now that it's here with us. But unfortunately, you do also understand that because we did not make hay while the sun was shining, it's not now possible for you to now feed your whatever kind of animal that you are trying to maintain in form of animal husbandry. How do I mean? If before now the country has prepared for emergencies such as this, it would have been easy that when we said we are locking down, to provide certain forms of palliatives that would last the people much longer. And if that happened, it would have been easier to deal with the issue of the pull and the pull factor. Pull in terms of what is pulling them to come and meet their daily needs, and then push in terms of you asking them to forget about that daily need and then stay at home. You recall that at that time where we even had some measure of lockdown, the spread wasn't as much as it is now. And I would just do hope that now that by the grace of God, the medical practitioners are beginning to understand the different strains much more than they were at the beginning, that we will begin to find at least a space to flatten the curve, and at the end of the day, by the grace of God, return to our normal life. What's happening now, they say the new normal. The new normal is not exciting at all.
Right.
But people need to meet government halfway. If government says don't do this, don't leave issue of whether you didn't trust government before.
Now,
know that
I need to ask
it
you
is
this
in the
question,
interest
sir.
of each and every one of us to observe those protocols.
Did you use only what was prescribed by the doctors, or were you using some home remedies to support that? Because quite a lot of people feel that sense of loss of smell, and they suspect, but they don't want to get tested. They just want to treat it at home. Would you advise people to get tested, or just find out home remedies to get themselves healed completely?
Self-medication cannot be an option in the case of COVID-19. The reason is this. Different individuals have different body type and then, of course, a different health situation. If you say because, number one, that the particular drug is administered to Mr. A, and then since you feel that you are having the same symptoms, you go and take the same type of drugs, that could be injurious because you may not know whether Mr. A has a system that is not riddled with some comorbidity, that is some form of pre-existing health condition. And so, if you take, for instance, somebody who has acute ulcer, and then I now tell you that when I had my challenge, as part of effort to keep the respiratory tract clean and then free, that I was asked to take very spicy and hot pepper soup. Can you also take the same? Now, if you also have certain kidney challenge, is it possible that you take the same drug with a man who does not have such challenge? And so it's not the right thing to do when people say, no, don't worry, go and take Abu, go and take this combination. Whatever thing you are going to do, it is important that the medical personnel gets involved so that they are first of all able to examine you to know that if you do know, a number of drugs is usually written that if symptoms persist after 2 days, consult a physician. In which case, it is possible some other ones, there could be contraindication that you are taking it and then it's now even causing more trouble for you than the problem you think you are trying to solve. But it's only the medical personnel that could subject you to one test or the other and is able to advise what you should take. So it is not advisable for people to just sit down at home and begin to take all sorts of combination. This is the doctors who will tell you, yes, you can take this and this. That if you have taken this orthodox drug, that you can also maybe mix it with some of these organic drug coming from traditional system. But without that kind of advice, I don't think it's advisable and reasonable for anybody to proceed to begin to take all sorts of concussion because you may end up causing more harm to yourself.
Okay.
It is possible that one person did it and it works for him, but that may not be the case for every other person. And so it's not advisable for anybody to just sit down at home and begin to treat himself or herself.
Okay.
Did you take any herbs when you were ill? Did you take any herbs?
Well, I can say yes, but that was also subject to the advice of medical practitioners, because ginger, garlic, turmeric, those are herbs. They are not the normal one that is already processed, the other processed drugs. So when you take them, or you even take lemon in your tea, it's assumed you are also taking herbs, because these are also things from plants.
Right.
And so when you do that, you can say yes, there are mixtures, but those ones also have their role in terms of helping you to build your immunity, and then also helping you to combat certain tendencies that may arise on account of the virus. And so the doctors will even tell you, okay, you take this, make sure you are taking this, but make sure you are taking this. But the idea of going to bring another concussion and then say you have a dogoyaro, you have this, everybody became doctor because of COVID-19. Some persons will read one thing on Facebook, and that is what they are going to ask you, okay, I read about this, they are prescribing, without knowing that you are not dealing with a car, you are dealing with the human system. And the human system is quite complex. So if you just feel because you have read about some combination on Facebook or in the social media, and then you are recommending same to somebody that you've not diagnosed to know how his or her body type is, whether he has pre-existing condition that may not sit well with those drugs you are recommending. So I do advise that if you feel any of the symptoms that have been well publicized that have to do with COVID-19, the best thing is you present yourself for test. And if you are tested and it is positive, listen to the medical personnel that will advise you, and not what you are reading on Facebook. That it works for A does not mean that it will work for B. And oftentimes, it will not work for many people.
All right.
So rather than people having to die on account of their carelessness, I think it pays them to take advantage of the advice of medical personnel.
All right, sir.
Where would expect that Nigerians will find it easy to walk into the centers and have themselves tested. How is the response in Delta State? Because I will be surprised to see if Delta is different from Lagos, that people are willingly walking into the centers for testing. How often do you see people come? What's the numbers like?
Well, let me admit that at the beginning it wasn't easy, because we didn't have so many facilities to carry that out in terms of testing. And so at the beginning it was not easy for you to just walk in and immediately you get tested and then you come out. But over time, health personnel and the government was able to find a way around it, such that we now have more than one testing center. At least we can test in more than 4 places, while the result is brought to a central point in Asaba for the purpose of subjecting it to clinical analysis. But in terms of taking the sample and then bringing it down, they can do that in a number of places. And then we're able, through our sensitization, able to also reduce the myth around COVID-19, so people gain some level of confidence. That fear of saying, no, I don't want to test, so that they don't say that I have COVID-19. And we kept telling them, it is not the test that gives you COVID-19. And there is no need to continue to live like the ostrich or to live in denial. If you don't have it and you go for a test, it will still read negative. If you have it and it reads positive, it gives you an advantage to start treatment immediately. Because early reporting is very, very vital for the treatment. So that if you just sit at home and say, no, I don't want to go and test, so that they don't say I'm positive, it is not they that say you are positive. If you are positive, you're already positive even before coming for the test. And so over time, a number of individuals realize that it's the right thing to do, because even those who you may call the elites, we are among those who said, no, I don't want to go for tests. Instead, let me just sit at home and begin to take this drug, because of that stigmatization they were seeing around. And I was wondering why anybody would want to stigmatize anybody on account of a virus that is not 100% within your control. It's not like HIV. And even if it's HIV, there is nothing that the man who contracted HIV is doing that any other person didn't do. It's just unfortunate that the person contracted the HIV. But you know, in this part of the world, we just try to play the ostrich and then live in denial. What if
Thank you very much, sir.
happened to somebody, every other person wants to behave as if it couldn't have happened to them. Meanwhile, they have done worse things than the person who is suffering that particular thing. So over time, people gain that confidence, and then at the time, you saw that our number was going up because much more number of people were presenting themselves for test. But at this moment, the curve is coming down, because when they did that, we made sure that we were able to ramp up all the different contacts that they had. And
unfortunately, we have to wrap up now, sir.
Also to present themselves for testing.
Right.
Though at the time, some of them they will come and present a different phone number and a different name, still part of the fear. But
Right.
with time, the people started realizing
Okay.
that there is no
Thank
need
you
to
very
begin
much,
to
sir.
go that way.
Thank you
Right
very
now,
much.
we are optimistic that our number will continue to go down, and by the
All
grace
right.
of God, we'll get out of it.
Thank you very much, Honorable Commissioner. We're speaking with the Honorable Commissioner in Delta State, Mr. Charles Anyagu. He was sharing with us his COVID-19 survivor story. Let's go on a break. We'll be right back.
You can watch Your View on TVC every Monday to Friday, 9 a.m. to 10:30 a.m. Nigerian time on DSTV channel 418, GoTV channel 27 and channel 47, Star Times channel 121 and channel 307, Play TV channel 801 and channel 190, UHF 49, Sky channel 515 for UK viewers. Watch live on Facebook at TVC Connect and on our website tvcentertainment.tv/livestream.